Welcome everyone to another broadcast of the Judge Hubert Radio Hour on the Artist First Radio Network. All past broadcasts are podcasts. Find them at artistfirst.com. And now your host, judge and author, the Honorable Judge Hubert.
Thank you, Scott, and Happy New Year to all of our listening audience. It is such a pleasure and a privilege to be with you. We have all survived 2023 in spite of the bumps and bruises that have come with it, and we're all still here, and that's a great thing to do. And so we're excited about what this new year is going to bring. It's my prayer that all of you will be blessed in everything you undertake to do, and may you experience the greatest year of your life. And of course, we here at Artists First are excited about what the prospects are for 2024. And of course, here on the Judge Hubert Radio Hour, we're excited as well, particularly as we begin to embark upon a new season, bringing you guests from a wide range of fields, particularly as we often focus upon law, justice, and education, all in the effort at trying to help make the world a better place through the sharing of information. You know, as you know, the theme of my radio show is based upon a phrase that a friend of ours used many years ago, and it's twofold in nature. One of which says that never go to bed as ignorant as you were when you got up this morning. Every day, you ought to strive to learn something new. That means that we're all lifelong learners, and we should be all about the business of learning, not burying our heads in the sand, but always striving to be able to be better versions of ourselves today than we were on yesterday. The other part of that piece is this. Education is the key to being and staying free. You know, we unfortunately are in a time and season where far too many people in this country and even beyond who feel that people should be hindered in their knowledge base. You know, we're grateful that over the last 20 years or so, we have seen the rapid development of the internet. And that means we've got access to information. We've got access to knowledge, and we've got access to be able to communicate one with the other. And so we should never, ever disparage that, but instead we should strive diligently to be able to learn more and to grow. And so that's what we're all about here on the Judge Hubert Radio Hour. And tonight's not going to be any different. In fact, I'm excited about our guest tonight that's going to be our leadoff batter for the year 2024. Someone that I've known for quite a few years, have watched her grow and develop into someone that I know can share a lot of good information with us, and to be able to be first place is certainly in my category. We're having a little bit of background noise, so y'all bear with us a moment. We'll make sure we get that cleaned up. But I want to welcome to the Judge Hubert Radio Hour none other than a young woman who is indeed a healthcare professional. She is a graduate of Florida A&M University, as well as with a bachelor's degree and a master's degree from the University of Central Florida. And of course, along that journey, she is, of course, a healthcare professional who is very accomplished in her field, having been involved with that for now some 20 plus years. But I'm going to let her give you a little more detail about her background and about the things that she does. And of course, let me welcome to the Judge Hubert Radio Hour none other than someone that's very near and dear to my heart. I like to call her my number one. She is indeed my daughter, and who is herself, as I stated earlier, a healthcare professional in her own right. I want to welcome to the call none other than Miss Ebun Iman Grimes, who's going to share with us. We're going to talk about healthcare tonight and see how we can become better educated in that process. Ebun, welcome to the call.
Thank you so much for that warm welcome. Good evening to you and to all of your listeners out there.
All right. Well, it's an exciting time, an exciting season, and we're all looking forward to what the new year is going to bring to all of us. I know that there's a lot of, chaos and stuff going on in the world. Unfortunately, we see a lot of, we got wars going on in multiple places, and unfortunately, we see people are still engaging in various kinds of, I will call it personal wars, engaging in all types of violence and not a day goes by that we don't hear something about somebody causing harm to someone else. But you have chosen, instead of being one to cause harm, you've been one to try to help steer people away from harm and help people to regain their health in so many ways. So let's talk about your background and how you got to the point of where you are today. Let's walk us through that. I mean, I know it and I'm proud of it, but walk us through how you got to the point that you are today as a healthcare professional.
Absolutely. I started in healthcare at the age of 18. I wanted to, previously as a child, I wanted to become a pediatrician, but I was awarded the opportunity from a very close aunt that is near and dear to my heart, and she allowed me to work in her office one summer prior to going to the illustrious Florida Agricultural and Mechanical University, I must say.
All right.
And that opportunity let me see the back end side of what I call healthcare. And from that, I learned that I no longer wanted to be a pediatrician, that I wanted to tell the doctors what to do. So after my first semester as a bio pre-med major, I changed my major at Florida A&M, also known as FAMU, to healthcare administration. And during that time, I learned theoretical knowledge as well as some firsthand practice knowledge by being able to do outreach within the community with the school, in conjunction with the school, as well as meet like-minded individuals who enjoy giving back. And giving back in a sense of not receiving monetary gain, but the great butterfly feeling that you get when you know that you've helped a patient or a member or even advocated for someone within your family. Excellent. And from that springboarded me into healthcare management literally throughout my entire career. My background has been in everything from accreditation to strategic planning to risk adjustment to national contracting, a gamut of different topics as well as service areas within the healthcare arena.
Now, you began your post-college days. I believe you worked at one of the state agencies, if I remember correctly, dealing with the public side of healthcare. Yes. Okay, and talk a little bit about that and how that is distinguished from, maybe we would say, the private side.
Public health is truly near and dear to my heart. When I worked for the state of Florida in Tallahassee, I was able to help with special needs programs as well as plans, which would help facilities as well as agencies ascertain their disaster recovery plans as well as other things. I also worked in public health research with a lot of grant-oriented programs, and we actually, under my tutelage, was able to award all the HBCUs in the state at the time with grants related to healthcare and public health research specifically.
Very good.
Throughout my tenure at the health department, I was able to not only tap into resources, but because I was born and raised in the state, I knew where some of what I assumed at the time were needy areas within the state. And that allowed me to create community partnerships with other organizations as well.
Okay. So what were some of those organizations, if you recall? Because I know I'm taking you back a number of years.
Yes, that's been a while. I would say one of the prominent ones would be, I worked with the American Cancer Society. Is one of the bigger ones.
Okay.
Definitely.
Okay. And then, of course, if I recall, after you left Tallahassee, you came back to Volusia County and you started working there with some other groups. And, of course,
Yes.
I remember more specifically, not only you did the HMO group, but I also remember you working with the health department. Talk a little bit about that and how that opened your eyes to some of the healthcare disparities.
In returning home from Tallahassee, I found or discovered that my community itself needed help. The long and short of it, I would say, is that if you go back to your own community, you're able to see the strain as well as the hope. And in that, I was brought in to help them lead the way in being the first public health department to be accredited, which I was able to succeed in that. In addition, though, I was able to be a community health advocate, and I was able to lead a team of people, and I was also on what was known at the time as the Midtown Heat Health Equity Action Team. I worked with children ages 9 all the way to 18 to bring in people within the community as far as health educators, learning how to eat clean, dealing with physical activity and the importance of physical activity in younger children. And from that was my greatest joy. I thoroughly enjoyed working for the health department. I will say that the public health side is a lot more strenuous activity than private healthcare from my 22 years of experience.
Wow. Okay. So now you did your piece with the public health, but then as we noted earlier, you've also been involved with the private side as well. Talk a little bit about the differences between the two and, what are your preferences as it relates to that?
I will say that I find eternal joy on the public health side. However, public health does not essentially pay the bills and set you up for the future. The private side, however, is more hands-off because I'm not in a role as like a community health worker on the private side. I'm actually a national contracting manager now for a Fortune 500 company. And in that, private healthcare insurance pays the bills and allows me to set myself up for future retirement, as well as it also gives me the time and space to allow me to travel the world.
All right. Well, that's good. And we know that you have, you've been doing that quite frequently here lately. Is that correct?
Yes, I have.
You put a plug in for that. Well, in fact, but, when you mentioned that traveling to other countries, did you have a chance to see some of the, I will call it health disparities in the other countries? I mean, oftentimes we see things that are promoted on television that seem to suggest that all the healthcare problems in the world seem to exist in other countries, and particularly in African and South American countries. But we also know that here in America, we've got a lot of health issues here with our people. And that's been one of the major, I will call it, non-stories that is oftentimes featured, is that we kind of cover up many of the health problems that we have, such as in Appalachia and many of the urban centers around the country. So have you had a chance to see, even experience, or even think about that or research some of those kinds of issues?
Yes, actually, I have. A friend and I previously went to Kenya in Africa a year ago, actually, and we were looking at potentially opening dialysis care centers in Nairobi, Kenya specifically. And from that, not only did we find the need, but we also found the lack of infrastructure. However, the cost of dialysis is not as expensive in Africa as it is here in America, because the American healthcare system is extremely expensive, and oftentimes it is not cost effective. But thank goodness for value-based healthcare now, that we're going more towards paying more attention to health outcomes and closing what we call healthcare gaps. And essentially, specific to the African American community, one of the biggest healthcare gaps is that we as a community do not go to see a primary care physician, or we do not have a primary care physician.
Interesting. Does that tend to lead to more serious kinds of health problems because of the lack of people either not having or not going to see their primary care physician?
Yes. So according to the Centers for Medicare and Medicaid Services, also known as CMS, Black people are oftentimes more likely either misdiagnosed or overly diagnosed. One, because they may not see a primary care physician once a year or as frequently based on the doctor's recommendations as they should. Or for Black men particularly, Black men a majority of Black men do not go to seek health care at all until something is wrong, whether it be something related to diabetes or hypertension. And hypertension essentially is a silent killer. And that affects the Black community more times than it does our white counterparts.
Okay. So if you were to make a recommendation or advice to our listening audience regarding the importance of healthcare, what would you say? What would you say in terms of the prevention side? How would you, what would be your recommendation as it relates to that?
My recommendation would be that people, regardless of color, creed, national origin, that they make sure that they find and locate a primary care physician that is under their coverage. And when I say under their coverage, making sure that they're within network with that doctor and that they see that doctor at least once annually. And that annual visit allows the person to not only be made aware of any medical conditions that they have, but that also affords the physician the opportunity to treat those pre-existing conditions or conditions that they may just be made aware of as well.
Well, if I might tell you that I have tried to follow that advice myself in terms of trying to get regular visits, having regular visits with my primary care. And I know for me that I saw the benefit that happened a few years ago when I was diagnosed. Had it not been for the fact that I had a primary care physician who was on it and on my case, then I probably could have had a much more difficult outcome. But I can certainly tell our listening audience that it's very important that you stop, that you pause, and that you do get yourself checked out on a regular basis, whether it's annually and then whatever they say beyond that as far as, follow-ups. Definitely need to do that, particularly as you've already stated. Some of the people that fail to do that for the most part are oftentimes men in general and Black men in particular. Maybe because they've been raised with this idea that they're tough and they cannot be what they say, they're bulletproof, I guess is a term that's often used. But like you said, it's so important that people do take care of themselves. Now, you mentioned, of course, the healthcare providers. And one of the things that we have in this country now that for years and years, this country has lacked, LACKED, proper healthcare opportunities. And we know now we have the Affordable Health Care Act. How has that been a difference maker in terms of people getting access to healthcare?
The Affordable Care Act, or known to most of the population as Obamacare, was passed in 2010. I will say one of the biggest pros for the Affordable Care Act, or Obamacare, is that it has afforded those people who have pre-existing conditions the opportunity to have affordable health insurance. One of the cons from Obamacare is that it comes with higher insurance premiums based on what those pre-existing conditions may be.
So
but overall, it has decreased the number of uninsured.
Okay. And when you say that it comes with a higher cost, is that cost now being spread across a larger percentage of the population in the country that's now allowing for people that previously were left out to be included in the availability of insurance, healthcare insurance?
Yes. It has afforded those who may be self-employed or who may not qualify or meet the requirements for Medicaid. It has allowed them and afforded them with the opportunity to have health insurance coverage.
You know, as we are thinking about this and the importance of people getting the health care, going in, getting themselves checked out. I mean, there's some people that in the past have just kind of used self-help. And there's nothing to be, I'm not against that, because we know that there are home remedies that sort of can be useful in helping to keep us from going to the doctor. But on the other hand, there are moments in time when people need to go. And so in that sense, I'm sort of glad that, as you said earlier, the Affordable Health Care Act provides a greater opportunity, or an opportunity for a greater percentage of the population to be able to have access to health care, even though many of them may not necessarily be fully aware that they have access to that. Comment about that in terms of your thoughts.
I think it's so important for us as individuals to make sure that we know the state of our own healthcare. It is pivotal, and literally it can be the difference between life and death when we are able to advocate for ourselves. Whether that's in the healthcare space or it's in the academia space. And the reason I say that is no one knows your health or your symptoms that you may be feeling the way you do. It's one thing to explain them to a physician who understands the ins and outs, but for you yourself to know if your leg starts hurting one day, but your leg didn't hurt the day before, by the second or third day, you may want to call your doctor to see what's going on, especially if it gets to the point where it's hard for you to walk on it. Or say, for instance, your foot swells and it doesn't go down after you've iced it. You want to call your doctor. You have to be able to advocate for yourself, because if you aren't able to advocate for yourself, it's going to be difficult when you get to the hospital, ER, urgent care, what have you, for them to advocate for you.
You know, many people have in the past resorted to the ER, the emergency room, as their primary source of healthcare treatment. So in other words, whenever they would ignore all the other issues that you mentioned, like that you just identified, until it got to the point where it's drastic, and then they would go to the ER. And then, of course, that became their quote unquote primary care doctor. And as you just pointed out, it's so important that you establish a relationship with a doctor who's going to have records, who's going to be able to see what you look like, acted like, were like, any other issues you had. I mean, it's important that they keep a record of your body, so to speak. They keep a record of your blood and any other issues that are there. And it's so important that as opposed to just popping up to the ER, because when you go to the ER, it should be because that's you're having some serious issues going on, and that should not just be your regular form of healthcare.
Correct. And I can't say this enough to your listening audience. The emergency room is for emergent issues. If you have a tummy ache, go to urgent care or call your doctor on a Monday through Friday if it's a weekend. The ER is for emergent issues, whether you see blood or whether somebody passes out. That is what the ER is for. The ER is not a primary care physician's office.
Amen to that. And of course, anybody that's gone to the ER on weekends, you realize that it is so often backed up, and of course you got all types of trauma going on. You got, unfortunately you got auto accidents, you got people getting shot, people getting cut, what we sometimes refer to as the Saturday night specials. And so you're right. If you can avoid that, by all means do so and focus your attention upon staying and maintaining your health as much as possible. Now, you mentioned earlier something that sort of ties into this, and that's the importance of physical activity. I was sharing with, of course, some of my very dear friends and close family members that I remember an article appeared in a newspaper, might have been a couple of years ago now, but most of us know Serena Williams, the tennis star. And Serena was on a nonstop flight from New York to L.A. And during that time, apparently, she didn't get up and move around. But by the time she got to L.A., she could barely walk. And ultimately, they diagnosed her with having blood clots because apparently, I guess, I'm out of position, but apparently the blood had settled in her feet because she didn't move the entirety of that 4-hour time period. And consequently, she had to go through some major healthcare treatment. I don't know the extent exactly of what it was, but I just remember that it let me know that whenever you're traveling, particularly like many people just came off the road or just came off of flights from the holiday season, that you need to make sure that you're moving about, so that, even if it's stopping every couple of hours to get out and move, or whether it is in an airplane, the same fashion. So when we think about that, what is the role of physical activity as it relates to maintaining our health care?
Physical activity is pivotal. The older you get, the more you will feel the difference. I will say, I'll give an example of pre-COVID or pre-pandemic. I was going to the gym 5 times a week to the point where I was changing my clothes at work and going directly to the gym because I knew if I came home to change, I wasn't leaving. I was going to find house chores to do or something to do on the computer to avoid from going to the gym. However, now, I'll say probably over the last year, I've gotten back into going to the gym, and it is not only my decompression, but it is another one of my safe places for me to decompress from the workday, decompress from life in general. I've created a whole nother family with my gym buddies, and we keep each other motivated. And when one of us doesn't come to the gym, we'll either text or call each other and say, hey, we missed you today. So we also hold each other accountable as well.
Okay. Now, and if somebody, for example, you have people out there who say, well, gyms are expensive and, they pass germs around in gyms. Aren't there some other options that people have, such as walking?
Yes. In addition to me going to the gym, I also walk the mall. Like, say, for instance, there's somebody who likes to see outside and they may not necessarily want to walk on the treadmill. You can walk the mall. There's people watching that I enjoy doing, as well as I'm making sure that I get my 10 to 15,000 steps a day. So if I don't hit that 10,000 or that 15,000 before I leave the gym and my gym workout is complete, then I'm going to go to the mall because it's a well-lit area, and I'm going to finish getting my 10,000 to 15,000 steps in the mall. Physical activity, at least 30 minutes of physical activity a day is important. It doesn't have to be jogging. It doesn't have to be running. It doesn't have to be anything high intense, but you got to make sure that you keep your heart going. And that 30 minutes can definitely make a difference. You can see the difference. I would say it takes, in the great words of Stephen Covey, takes 21 days to create a habit. And it can definitely take 21 days to create the habit of creating a new goal or a New Year's resolution, for that matter, of 30 minutes of physical activity a day.
Well, I have to say that I've been guilty. It's particularly for the last 6 weeks. My gym work has been lacking, but I actually went back, got back started again, actually as recent as yesterday. And so I too know that I feel much better whenever I work out. So even if I'm not working out in the gym, I try my best to get some steps in. We're fortunate here. We're coming to you all from Florida, so I can tell you that I use there's some walking trails around. There's right along the riverfront, so you can get the beauty of that. We got bridges here that got walking paths. So I encourage those of you that are out there in the listening audience. I know we're getting into the wintertime, and a lot of people are inside, but find something that works for you and help yourself so that you can strengthen your body. And believe it or not, when spring gets back again, you'll be in a much better place than you were this time last year. And of course, keep it up. I know you're a great proponent of it, Ebun, and I'm glad to hear what you're doing and how you are not only taking care of yourself, but you're also influencing the lives of so many other people in the process of it all. And then, of course, you've talked to us a little bit about that. You said earlier about eating clean. What exactly is eating clean?
Eating clean means different things to different people.
Okay.
I will say that my version of eating clean is that I don't eat anything white. In the words of my aunt who let me work in her provider's office, if it's white, don't bite. And I don't bite anything white at all.
So go into detail. What does that include?
And let me give some examples. I don't eat white bread. I don't eat white rice. I rarely eat bread at all, actually. But the good thing about carbohydrates is they actually help hydrate your body. But too much of anything is not good for you. So I have my biggest meal at lunchtime because that gives me more time to burn off maybe that brown rice that I had today, along with some broccolini and some salmon. But for dinner, go ahead.
Go ahead. No, go ahead.
But for dinner, I may only have some field peas and broccoli, or I may have a salad with some protein on it, because protein is also very important for your body as well.
Okay. How important is water?
Oh, wow. Water is essential to the soul. Based on what I learned during my public health career, You should have the amount of water a day that a person should have, is their weight divided by 2. And that is how much water I have and that I consume every day. Sometimes you may have to add a lemon or a lime in to taste, because water tastes like nothing. But it definitely helps flourish your body and your bones. And it's extremely refreshing.
Okay. A lot of people say they don't like water. They don't like the taste of water. And you just mentioned about lime. But there are a lot of different products out on the market these days that, in essence, can make water taste better. I even noticed you doing various kinds of fruits that you put in the water and create a big picture of water in your fridge, and then you use that throughout the day. What does that do? Talk about that and give that as an example for some of our listeners.
So the water that you're speaking of is, sometimes I have a detox water, and then other times I have a refreshing water. So my detox water will normally have strawberries, blueberries, raspberries cut up, and then I'll have that in there along with maybe like a few mint leaves, because then that way the water is actually helping break down whether it's good, bad, indifferent, right, wrong. It just works for me. I'm not a doctor. I'm just speaking solely on what works for me. It helps me flush my system with the detox water, and it helps give me energy. Versus when I drink what I call my regular water, is I'll have lemon, lime, oranges, peaches, different fruits in there also, and that gives the water a different taste, so that I have some type of flavor while I'm drinking the water, so it just doesn't taste like blah.
Okay. And of course, we know that this, so many commercials on TV, particularly as we're getting close to the end of the football season into Super Bowl, they tend to promote a lot of what we call carbonated drinks. What effect does carbonated drinks have on the body as opposed to water?
Carbonated drinks are full of aspartame or some type of sugar. So when you say you want to mix water with sugar, unless it's something, I have a friend specifically, she may be listening to us, and she loves the Perrier or the what is called SodaStream carbonated water. And that's what works for her. So ultimately, you have to find what works for you. But any type of sodas, all of those juice drinks, I don't drink soda at all, because a can of Sprite itself has 40 packets of sugar in it.
Wait a minute. Say that again.
A can of Sprite has 40 packets of sugar in it.
Okay. All right.
Alone.
Well. 40 packets of sugar.
40 packets.
I'm emphasizing that because I don't think that people oftentimes realize how much sugar is. I mean, they promote Pepsis and Cokes and all the other stuff that goes with it. But if it's that much sugar, doesn't it have an impact on other parts of the body?
Yes, it does. Yes, it does.
Okay.
Diabetes is a part of one of the diseases. It's a chronic disease. The diabetes is actually a chronic disease. And that is where you're not producing enough insulin because of all the sugar. And type 1 is where you become insulin dependent, and type 2 is where you have diabetes, but you may be taking some form of a pill, not necessarily insulin for it.
Okay. And of course, diabetes can result in some horrible, horrible consequences in terms of the, not only treatment, but even the type of treatment and things like kidney failures and things of that nature. Is that right?
Yes, that is correct.
And of course, you had mentioned earlier that while you were traveling, you and one of your cohorts were looking at the possibility of developing kidney dialysis centers in other countries, and certainly that is in itself a direct result of probably oversaturation of sugar. Would that be appropriate to say?
Yes. That is correct. That is a very correct statement. Along with, we had this wild dream of providing some of the American healthcare to people that look like us on another continent, because we wanted to give them the chances that others may not have had who came before them.
Wow. Okay. Well, certainly what you're suggesting is that if we take care of ourselves, then our bodies will take care of us and not find ourselves in some of the difficult moments that unfortunately far too many people end up in.
Exactly. And I do want to add that the same goes for salt intake as well, similar to sugar. The difference between the two is that salt leads to hypertension, also known as high blood pressure. And hypertension in and of itself is also affects and impacts the Black community, because hypertension is seen as a silent killer.
So in terms of what you noticed in the when you were dealing with the public side, did you engage in any type of workshops or efforts at trying to educate people about this particular, what you just stated, this particular, the dangers of sugar and salt?
Oh, yes. An event particularly that comes to mind is we did a summer camp at the Volusia County Health Department. And I was in the community, I think it was called the Community Health Department at the time. And we wanted to provide children with healthy alternatives. So we did a camp. It was a full day where they got to see how to create different salads from a vendor. They were given different types of fruit, and we discussed the different nutritional values of the fruit and what they were good for. We also had different areas where the children were able to test their knowledge or comprehension by saying, okay, well, if you listen to us for an hour, we'll then play a game. And from that game, whoever answers the questions will win a prize.
Mm-hmm.
And then we also added physical activity in there, where we had dance instructors come in and they did different activities with the children also. And that at the time was one of the biggest community event turnouts that we had had.
Wow. So daily, people should be engaging in preemptive or preventive types of activities to help them to keep their health going, since all too often we don't hear enough about that. People like to quote unquote look good to dress good, but what you're sharing with us tonight is that there are some other things that are just as important, if not more so, in terms of maintaining our health. Could you elaborate on that a little further?
Sure. Something that I love to say, and I actually wrote it on my bathroom mirror when I reignited, I won't say started, but when I reignited my physical activity journey, and that is health is wealth. Your health is your wealth. The money can come and go. The people can come and go. The cars, the clothes can come and go. But your health should be your primary importance, because your health can make or break you. And I myself am a testament to that, because I myself have gone through a number of healthcare challenges. And if I were not in tune with my health and what was going on with my body, you may not be talking to me tonight.
Well,
but God had other plans for me.
I am certainly glad to be talking to you today. There's no doubt about that. And I got a feeling that the feeling is mutual, as we say.
Yes, it is.
Yeah. Well, now, you mentioned that, I have to throw this out since I'm going to get personal for just a moment. One of the things that you helped me with, really, I guess it was a couple months back, was in helping to identify my healthcare plan for the upcoming year. When we have the open enrollment season for my employer, many of you have it also for the Social Security side, and other companies are doing the same thing. And you helped me to understand a lot about the system that I had completely overlooked, and even down to things such as choosing, I believe it was the health savings account, something that I had completely overlooked, but it was a great, not only a savings, but also a tax benefit that would be very helpful. So, and I was thinking about that, but I was also thinking about some of the other things, such as a lot of people don't understand the significance of Medicare, and certainly don't understand the distinction between Medicare and Medicaid. So, elaborate on some of that for me. In one, the importance of checking your insurance coverages, your health insurance coverages, for those of you that are out there each year. And secondly, identifying the differences between what people often hear, Medicare and Medicaid, and they don't really necessarily take the time to know what that's all about.
That is the $1 million question. What are the differences between Medicare and Medicaid? Medicare specifically is for people age 65 and older, or they have a disability, have Lou Gehrig's disease, also known as ALS, or end-stage renal disease, which is where an individual is put on a dialysis machine. Medicare is important because Medicare pays 80% after you hit the age of 65, of course. And one thing, luckily for you, Daddy, is that you're still working. So Medicare comes in as your secondary insurance because you already have employee-sponsored health insurance. So that actually helps you because Medicare pays 80%, and then you're responsible for the 20%. But because you're still working, that is not the case. Medicare, in your case, picks up that amount or that coinsurance that your employee-sponsored health insurance will not pay or may not pay.
Well, I certainly hope my listeners got a hold of that one. One of the complications of our healthcare system. Go ahead. Continue.
On the other side, Medicaid itself, and both of these are federal government-sponsored programs for insurance. Medicaid is for Americans who are eligible, low-income adults, children, pregnant women, elderly adults, and persons with disabilities. Medicaid, however, is state-specific, and it's funded through the government and states jointly. So Medicare itself is overall. That's the overall arch for people ages 65 and older. But under Medicaid, there are a number of different, not only socioeconomic classes, but other groups of people who may qualify for Medicaid. And if those individuals are unable to qualify for Medicaid, there's also another program called the Children's Health Insurance Program. I call it CHIP. And it offers federal matching dollars to states to provide health coverage to children and families that do not meet the qualifications for Medicaid, but can't afford private insurance.
Wow.
So there are multiple layers to this healthcare thing.
And, I recall that unfortunately in Florida, we've got a governor who has not engaged in, I guess you could say, accepting the medical, the full range of Medicaid options that were available from the federal government. They didn't expand Medicaid capabilities, so therefore there were still a lot of people that otherwise could have been covered that were left out.
Yes, that is correct. Yes. So for those people who were left out of Medicaid, CHIP would be another option for them.
So there is always some place to fall back on.
I won't say always. It's more like sometimes, and you have to weigh your options.
Okay, very well, very well. Yeah. Well, certainly, I know as we are rapidly running out of time here, are there any particular things that you want to share with our audience that you believe would be of great help? I mean, we've hit on things like the importance of annual physicals. We've hit on things like make sure you review your healthcare coverages and make sure that during those opportunities that you have to make adjustments that you follow that up. And of course, even if you may have believed that you might have missed the deadline, it still doesn't hurt for you to contact your provider because some of them actually have windows of opportunity afterwards so you can correct problems that you might have had or something that you might have intended to check box A and ended up checking box B. Is that something that's still available for most places or most companies, or is that just on a case-by-case basis?
Are you talking specifically about insurance coverage, or are you talking more so about treatment of a specific ailment?
Probably a little bit of both. Probably the insurance coverages comes to mind first of all.
Okay. So open enrollment period for Medicare has ended. That ended at the beginning of December. However, if there is a qualifying event, i.e. someone's about to turn 65 or they've just been informed that they have a debilitating disability, that's known as a qualifying event on the Medicare side. A qualifying event within the commercial line of healthcare would be if someone adopted a baby or if a child was born, things of that nature. And when there are qualifying events, then you can definitely make changes to your medical coverage.
Okay. All right. Well, now, if anyone wanted to get in contact with you to do some follow-up conversations regarding healthcare, or maybe could get you to point them in the right direction, how would they get in contact with you?
That is a wonderful segue. With the love that I have for healthcare and the love that I have for Black and brown people that look like me, I actually started an LLC last year called Iman Consulting, and it will launch in 2024. Particularly the topics that will be addressed or the things that I will cover under the LLC are healthcare navigation, healthcare advocacy, and mobile notary services. And I will have a website that will be up soon, probably within the next month or so. But in the meantime, people can feel free to reach out to me on Facebook, Instagram, or they can feel free to give me a call. Okay,
very good, very good. Well, let me take a moment to thank you for taking time out of your schedule to be a part of this discussion tonight. Certainly, we always seek to share information that's going to make people better in what they are doing, and to be able to deal with the challenges that we all encounter in our daily lives. So you have been a godsend in this respect, and I must say what I often say to you, as when I ask you questions about healthcare, and you always come up and you give me an answer. You know exactly what I'm going to say. For those of you all that don't know, I always tell her she's become a great return on my investment, and I'm so happy that you are doing wonderful in an area that you love and an area that you're making a difference in the lives of people. So once again, let me just say congratulations. Continue to do great work. You've been at it for over 20 years in multiple fields. And I just truly believe that this year and every year hereafter, you're going to see the best is yet to come. So thank you again for being with us. And as we get ready to sign off tonight, my friends, I hope and pray that you all have heard something tonight that has educated you, that has made you better, that maybe even causes you to get up and do something that you hadn't been doing before. And, of course, as we began our show, we end our show. Never go to bed as ignorant as you were when you got up this morning. Every day, you ought to learn something new. So it's my hope and my prayer that you learned something new here tonight on Judge Hubert Radio Hour. God bless you all, and until the next time, we'll see you then. God bless.